the long-term damage that you've seen can happen to some of these young people that are being resuscitated like over and over again?
Oh, the big things that we see, I mean, aside from the lung disease and transplantation, what we've seen is cognitive. People that have been through this whole process, they don't recover cognitively. Even doctors, even pretty much any age, there's something that happens to them that they're slower. It's hard for them to process things.
They call it brain fog. A lot of the times they're calling it brain fog, but I've heard there's also cognitive decline where people's IQs will actually go down. And is this brain damage? Is this neurological damage?
Yeah, it's yes, it is. It's you know, you would put it under the framework of having some kind of encephalopathy. It's not really an encephalitis, but it's dysfunction that happens early. It's perhaps all the chemicals or the medications that we give you to save your life, plus the low oxygen. And some of the neurons, you know, as a result, the coordinated response, the coordinated, you know, electrical or endocrinological, neuroendocrinological activation that leads to executive function and meaningful outcomes. It just becomes slower, it becomes impaired. The other part about this is that, you know, when you're sedated on a ventilator, your body is creating memories, and the memories are very vivid. It doesn't mean I remember being on a ventilator, but there's something that the mind experiences during that time, and it floods the neurons. And so now you're confused. You don't know if you've seen it. You don't know what's up and down. You don't know what's happened.
This is becoming like the PTSD, I think, that they're saying that a lot of the ventilated patients have like nightmares.
Yeah.
You don't even remember about what, but it's
it's PTSD, but it's more, it's more of PISD, like post infection stress disorder. It's just about it's a profound. So that's number one. And then the other class to this is cardiovascular. We know that the Delta strain, and some of the earlier strains, they can be cardiotropic. You know, they sort of attack the heart, they attack the cardiovascular system. Sometimes there's overt heart disease. Sometimes it's the ability for the body to react to stressful situations or exercise, to be able to, you know, the heart rate to go up. For, you know, it's not 100% coordinated. The best way for me to describe it is that if you have a, you know, certain European sports car, when you tap on the accelerator, you immediately, the response time is immediate. You're moving. And then if you have other cars, you tap on it and there's sort of a delay, and then you're moving. So you're not as sharp as you were from a cardiovascular, from a neural standpoint. There's a bit of a delay, and I don't know what the long-term effects of those are going to be, but it's soon to see. I'm really referencing people that have had it this, you know, the beginning of this year and in the past.